Welcome everyone to the discussion on access to COVID-19 vaccines for Africa, brought to you by Africa Health Business in partnership with ADS Group, Equity, G42 and Mansa Media. My name is Kaushal Shah and I'm the head of Pharma and Healthcare at the firm. Before we start the discussion, I would like to take you through some housekeeping rules. Attendees will be on mute during the session. This webinar will be English and this is a 90-minute event. On this slide, you see the agenda for today. I would like to reiterate that this is a 90-minute session, and now I would like to hand over to the moderator of the session today, Dr. Amit Thakur. Thank you.
Thank you, Kaushal, and thank you to the attendees and the panelists. We actually have a star-studded panel today. We have Professor Karim from South Africa. We have Dr. Dembi from Africa, CDC, Dr. Angama from Africa Union. We have a very good continental approach. And I think the conversation around vaccines is absolutely vital. But I must let you also know that it'll be ongoing for quite some time when it comes to 2021. Virtually the whole of 2021 will be dealing with the vaccine program and the cost of vaccines and also how much availability and safe, reliable, and affordable will be the structure. We'll hear more from our keynote speakers. And on the next slide, I'll just like to share with you and recognize some interesting initiatives that are taking place for COVID-19. You can have a look here. Over time, this has been what we've been spending on vaccines. And it's pretty clear that when you don't have a high GDP, you need support. If you look at the dollars per infant on vaccines spent by the government, you will realize that we need to do much more in Africa if you compare it to Australia and other countries. And on the next slide, it's not only the cost of vaccines, like we heard last time. Everyone's talking about how much money and what's the cost of vaccines and what will it cost us to buy these multi-dose vaccines. But look at this. We've got 5 other challenges. And just last week, when I was the Minister of Health in Kenya, it was very clear that out of these 5, the 2 most important things we have to deal with is the cold chain, literally having a refrigerator system that will keep the vaccines intact and safe in the deeper parts of our counties so that it remains effective. So that's one quick challenge, and it may be an opportunity as well for private sector to come up with innovations like solar and everything else, but the logistics will be a major issue. We have a logistics partner who will tell us more about it today. And then the second one is we need the manpower, and the overstretched already system in our countries have to cope and to deal with the vaccine program. And you read this vaccine program in the UK, that's also much debated over the last 2-3 days. And so it's not only the cost of vaccines. And this is what I'm sure we will highlight along our conversation. So in the next slide, I want to give a real thanks to COVAX. They are ensuring global equitable access. It's a lot of work, and it's to deliberately make promises and to make impact so that we have equitable vaccines available to enable at least the vaccines to be delivered as soon as they are there and to rebuild our economies. On the next slide, a special thank you to the COVID-19 Tools Accelerator. We are delighted that Norway has teamed up with South Africa in the leadership of ACT Accelerator. Today we have the vice or the co-chair from South Africa who will tell us a little bit more about what this COVID-19 Tools Accelerator means to us, many of us who are based in different parts of this continent. But a real big thank you to Bill and Melinda Gates Foundation, CEPI, FIND, Gavi, the Global Fund, UNITAID, Welcome, WHO, and World Bank, just to name a few people who've been in the core of ensuring that the vaccines, therapeutics, health system, diagnostics, and also allocations are equally given attention as we move into the conversation of vaccines. I wanted to set the stage, but I want to also take this opportunity to learn from our luminaries on the panel today of where we are when it comes to the roadmap to vaccines for COVID-19 in Africa. Let me now invite two keynote speakers who will be given 10 minutes each. Thereafter, we will have 5 minutes to the panelists, and then we'll have a power minute for the rest of the respondents and people who will be reflecting. Dr. Nikais Dembi is the Senior Science Advisor at Africa CDC, and I will like to invite him to give us the first keynote address. Welcome, Dr. Dembi, over to you.
Thanks, Amit. Please, can I actually share my screen? If you can enable that, sorry.
Yes, of course.
Okay, great.
So could the organizing team drop this slide down and let Dr. Dembi? Thank you so much. Over to you, Dembi.
Thank you. Yeah, thanks. Really, thanks again for inviting Africa CDC to present really the continental Africa CDC continental strategy. Yeah, I think today the focus is on access. Just for really as part of the background, we've said that or presented last time again from the previous sessions, but it's good probably for really focus to really take us, our audience through the 3 key pillars for the Africa COVID-19 vaccine strategy. The first pillar is around clinical trials. So we had a continental virtual conference in June, and following that virtual conference with about 3,000 delegates attended, we launched this consortium, the Consortium for COVID-19 Vaccine Clinical Trial called CONVAC. Really, that's to ensure that Africa participates in COVID-19 vaccine clinical trials. I did mention also that we have mapped some, potential clinical trial sites, and also we have some tier-ready sites that are really ready to undertake clinical trials on the continent. The second, it's actually the focus of this discussion, is around access to sufficient vaccine supply. And also, I did mention that early last month, the chairperson of the African Union established what we call the African Vaccine Acquisition Task Team. And then the point, actually, the mandate is to look at access, financing, and procurement so as to secure timely, sufficient, and equitable doses for all member states. And then underneath, you also have the manufacturing capacity, scale African vaccine manufacturing capacity to produce COVID-19 vaccines. I think we all agree this is a challenging time. We all agree that it's an unprecedented time, and we actually would like to build on to really have manufacturing capacity on the continent to be able to really respond to future pandemics beyond COVID-19. So the last pillar is around really regulatory, being sure that we remove some of the red tapes that can actually delay the deployment of a COVID-19 vaccine once it becomes available. So, and then we have uptake. Africa CDC is conducting a continental survey to be able to address issues around vaccine hesitancy and vaccine perception. And lastly, on delivery, and which is also key in the deployment. So let me take you through this slide. The point here, we are a little bit thinking beyond, and we're very optimistic it's doable. Vaccinating 60% of the population, that's the aim. Vaccinating at least 60% of the continent population within at least two years. That's the goal of Africa CDC through the African Union. So it means about 780 million people to vaccinate. So that is beyond the 20% that we're all aware. So we are mobilizing resources to be able to cover the extra 40% to reach the 60%. The rationale behind it is more scientific, so as to reach herd immunity. That's what we're targeting, that range of about 60%. So if you look on the right panel, the cost of purchase will be at, if you put all, that's about $9 billion US. So we're trying to really support that through, one, the COVAX, which we have all encouraged member states to sign up. Then the second, to the World Bank and also donors, and lastly, a specific financing instrument developed through Africa CDC with Efficacy Bank, which we can actually be able to secure about $5 billion US to cover extra requirements. So this is a bit a breakdown. So through the COVAX facility, the cost of purchase, cost to purchase vaccines, the cost to vaccinate, because we all agree that vaccine and vaccinations are two different things. So now if we look at the breakdown of $9.1 billion US, we actually expecting at least 1.8 to the COVAX donors, and the country self financing, and then the World Bank that I did mention, and the Efficacy will cover the extra cost to be able to achieve the 60% vaccination that we aim. So I clearly stated that we'll fully commit financial and political support to the COVAX facility. It's very important to state that at this point, and it's a very great initiative. And then the second, we also encourage member states to pursue a non-competing direct deals with manufacturers towards to cover whatever requirement will be needed for the continent. So let me dive into this slide. Very important, as we talked about access, we talked about deployment of a safe and efficacious vaccines. We talked about vaccine and vaccination. So let's put in the context. So vaccine efficacy. So there will be a key point that we might not compromise on in terms of selections, efficacy, and then also safety. So if we put in, for example, vaccine with a 70% efficacy, you're going to look into that coverage. Once, look at the coverage, and I'm happy. I did mention, and then from previous also meeting we had, the coverage from some of the traditional vaccines we have is not as 100%. So let's be quite sure on that. So if you have a coverage of 60% with a vaccine efficacy of 70%, and they will be expecting, based on this modeling, at least a population immunized, 40% of your population will be immunized. If you look at a higher ones, about 70% coverage with a 70% efficacy, you're around 49% rate of immunization. So I think that's where we're really looking in closely in terms of selections, in terms of logistics. It means that having a lower efficacy will require, vaccinating really about 80% of your populations, and that will come with a cost. So if you look at 80% vaccine efficacy with a 60% coverage, you can see that the numbers are a little bit shooting up. So a 90%, 95% efficacy, and then 60% vaccine coverage, you can see that we're around that 60% at least. We're close to achieving what we're expecting, at least our herd immunity. So I think that's what, from the Africa CDC perspective and African Union, we're still working on, trying to ensure that we have all the requirement needed to deliver, and then also have enough vaccine doses available for at least 60% of our population. So I will definitely leave you on that. And then with a good note on this survey, which is being actually, if you're familiar with the economics, very clear. If a vaccine for COVID-19 were available, I will get it. So the percentage, and then if you look at that, we have South African there in this survey. is actually between lies between 60 and 70%. From the data actually gathered from the Africa CDC and African Union to the global survey, continental survey, we also lie around, it lies between 70 and 80% vaccines acceptance, which is a good news for the continent. So thank you, Amit, and over to you.
Thank you. This was really, really amazing. I am so happy that Afreximbank, World Bank, COVAX, but there's also element of self-financing that will be important. And I really want to now dive into the 60% mark that you talked about. I'm sure Professor Salim Karim will tell us about whether the herd immunity, we should raise it to 70% or 80%. But it's my pleasure, having interacted with the Minister for Health, Dr. Zweli, many times. He mentioned you at a couple of meetings, and I'm delighted today, Professor Karim, you can join us. We witnessed how you've been in the forefront in South Africa and managed scientifically through a difficult time in South Africa, as one of the countries in Africa that have been tackling the pandemic. So please welcome Professor Karim as our second keynote speaker to speak to us on the direction we should take on this vaccine journey on Africa. Professor Karim, over to you.
Thank you very much, Dr. Taka. It's a great pleasure, indeed an honor for me to be here with you today. If I can just ask that the slide be removed so I can share my screen. Well, Dr. Taka and fellow panelists and distinguished guests, it's a pleasure for me to be your second choice speaker for this slot, because your first choice speaker is very busy in cabinet meetings today, and that's our Minister of Health, Dr. Mkhize. He asked me if I would be willing to stand in his place, and I said, of course, I'd do so with pleasure. So unfortunately, you don't have the star of the show. I'm just the stand-in actor for this slot. But really what I want to do is I want to just share with you very briefly my thoughts and suggestions around how we should look at the issue of access to vaccines, in particular, giving you some context for a discussion around private and public-private partnerships and how they can take us forward in achieving vaccine coverage. So I'll talk about what do they mean, and I've used South Africa here, but actually it could just as easily refer to the whole of Africa. So I'll talk about the urgent need, I'll talk about some of the results, I'll talk about the pipeline. I'm going to try and do all of that in the next 10 minutes or so. So we know this only too well, but I want to just bring your attention to the diagram on the right-hand side. This is the 7-day average of the number of new cases that is occurring each day globally. I mean, it is striking how this epidemic is just like a runaway train. It has shown no signs of decreasing the number of cases each day. We are now well over 500,000 cases per day. And I mean, just to think about what that means at a global level. And that almost all populations are still at risk, even those that have had very severe first waves. And that data, for example, comes from Manaus in Brazil, where after the first wave, 66% of the population was found to be antibody positive. And now Manaus is now in the midst of a second wave. So there's really nowhere to hide in dealing with this pandemic. And that stay-at-home orders and other restrictions are really not sustainable. And we've got to deal with this epidemic in totality. There's no way one country is going to pretend that it can control this epidemic and think that if it vaccinates its population, the problem is solved. And that mentality is quite common, especially in the US, that they really believe that that's how it's going to work. It simply doesn't work like that because of the interconnectedness and the globalization that underpins our entire world. It's based on the ability of movement and this virus will move with that. And so all countries will be at risk for as long as one country is at risk. So what do we know about the trial results? And I won't spend too much of time on this, but the first trial to release results, and this is their final results from 170 endpoints, is 95% efficacy, is the Pfizer-BioNTech, a new platform, complete new technology, messenger RNA. And the one challenge with dealing with this, you may have heard of, is that the vaccine needs to be stored at very low temperatures. It's also quite an expensive vaccine at $20 per dose. Shortly thereafter, we heard Moderna release their results, very similar to the Pfizer-BioNTech results. The Moderna NIH vaccine is very similar to the Pfizer-BioNTech. It's also a messenger RNA platform. And in both these studies, the results are really robust in that the vaccine protects, no matter whether you're old, white, green, doesn't matter. The Moderna vaccine has slightly less cold chain requirements, but still requires freezers and fridges for storage, and it's more expensive than the Pfizer-BioNTech vaccine. And these are just estimated prices, by the way. Then we heard from Russia, where they released results, and this is from quite a controversial trial because we actually haven't seen their protocol. They haven't put up their protocol as you would normally expect in science. But their results, which were just from 20 endpoints, and so one can't really make much of this, they reported 92% efficacy. Now, the difference is that this is a different platform. This is a recombinant adenoviral vector, and these are human adenoviruses that are being used. And we don't know the cost, and right now this is already being rolled out, even before these results were available, being rolled out in Russia. And then finally, we heard most recently from AstraZeneca, University of Oxford, in their trial of 131 endpoints, which is an interim report, they showed 70% efficacy. But within the study, they made a mistake and ended up giving some people the wrong dose of vaccine and ended up with a higher efficacy in that subgroup that got the lower dose of the vaccine. But that's a smaller subgroup within the overall trial. So we don't know what to make of that. We don't know how reliable that is. And often in trials, if you have only a small number of people, those early promising results often get overturned. This is also a recombinant adenovirus, though it's a chimp adeno, so humans have not really encountered it before. One of the advantages of using recombinant live viral vectors is that the storage requirements are normally, within the ambit of just keeping it in refrigerators. A price is lower at around $4, as you would expect. Now, what don't we know yet? So we know about these 4 vaccine results. I'm showing you those results on the right-hand side. What don't we know yet? Well, not a single one of those 4 trials have released any results that we can really review. And without that, we don't really know what these results really are and how robust are they, how reliable are they. We also really don't know whether we're comparing apples with apples because we don't know about the endpoint details. We don't know how they measured severity. We don't know whether they measured asymptomatic disease in the same way. We also don't know whether in each of these trials, whether the vaccine prevents both mild and severe disease. 2 of the trials have reported that there were no cases of severe disease at all in the vaccinated group. So that's a good sign. It means even if it doesn't prevent the infection in total, at least it prevents the severe form of the disease. So these are 3 things that we will expect to hear when the final results are released. But there are 3 things that we will just not know for a long time. And that's, what's the safety when you start giving these vaccines to millions of people? We've never given either of these 2 technologies to millions of people before. We've never had a vaccine with these technologies before. Do we know what the correlative protection is? What is it that's actually protecting? Is it an antibody level? And how long does it last? Is this protection going to be lifelong? Do we have to vaccinate every year? We don't have that question. We're not going to know the answer to that question for quite a while. So one of the things is I think we will be expecting more good news. Now, I don't know this for sure. I'm just projecting. And this is because we have 12 candidate vaccines in advanced trials. And all that we've heard about so far are from 4 of those 12. So there are 8 more we haven't heard yet. And that's, I'm showing you their logos on the right-hand side. Now, there are 2 things that are important. The first is most of those candidates where we have phase 1 data, their phase 1 studies show similar levels of antibody production in most cases to the 3 candidates, the 4 candidates that have already announced results. So in other words, if antibodies are anything to go by, we will expect that these 8 candidates that still remain are likely to have similar high levels of efficacy. I can't tell you that for sure, but based on what we've seen, that's what I would expect. So that we would expect all of these results within the next several weeks. I would say by the end of January, we'll have many of these trials reporting results. Now, what's important is that some of them use technology that's really cheap and technology that we already know, like protein subunits. That's something we have many vaccines right now, and we can make that anyway. That's not anyway, but it's much easier to make, very cheap to make. So as we will see these new results becoming available, we can expect to see, in my way of looking at it, we're likely to see some good results, more good results, and we're likely to see vaccines that are easier to store, cheaper to give, and even in some instances, give a single dose instead of having to give 2 doses. So lots to think about. And if we thought there's complexity in this field, there's going to be a lot more complexity. But in the riches of the diversity we're likely to see will come the advantage of choice. And that will mean that we will be able to access candidates much faster. If we've got 10 companies manufacturing hundreds of millions of doses, we can access those vaccines much more quickly than if we only had 2 or 3 candidates and depended on competing for those with the rest of the world. So I think this landscape is going to change quite rapidly within the next 3 months. So let me end off with the big issue, which Nikesh has already covered much better than I. I borrowed from Professor Roy Anderson's paper in The Lancet. Roy Anderson is the doyen of herd immunity. I mean, his work really created this field. And I used his crude calculation from his Lancet paper of 1 minus 1 over R naught. And if you base R naught on our pre-lockdown level, somewhere between 2.5 and 3.5, you basically get to a point where herd immunity, just for illustrative purposes, I've used 67%. So if we want to aim for 67%, 2 out of every 3 people in each country having protective immunity, then we're going to need to vaccinate a certain number of people. So if you have a 95% efficacious vaccine, you're going to need to vaccinate 70% of your population. However, if you're going to use a vaccine that's only 70% efficacious, you're going to have to pretty much vaccinate everybody, which is very difficult to do. So you can see the importance of having a high efficacy vaccine because it makes the achievement of herd immunity a much more doable and feasible concept. I'll just end off with the issue of that, while we're grappling with this issue of all of these different candidates, rich countries, of course, have been spending their money pre-ordering many of these vaccines. And from this article in The Economist, you can see Canada has already pre-ordered and paid for up to 9 doses per population, per person in their country. So because they don't know which ones are going to work, they're having to buy a whole lot. And they have to hope that some of them will work so that they've already bought it and paid for it. So you can see the high risk situation that they've had to take. And of course, that's not a situation we can get into. We have to wait till we know whether the vaccine works, and then we can purchase, because we not only need to know that it works, we need to know that it works and it's something that's feasible for us to give out. We can't choose a vaccine that we can't give out. We've got to choose something that is feasible within the context of our health infrastructure. And you can see how each of the big companies have already sold much of their product. And you can see COVAX on the right-hand side. So India, the European Union, US, COVAX, Britain, and Japan have been buying up quantities of the candidate vaccines from each of these 4 manufacturers. Let me end off with just saying that, we will need to find some way to decide which candidates to take up, which candidates to make accessible. And these 5 characteristics will be those that we use: safety, efficacy, cost, ease of storage and administration, and number of doses, because all of that together will give us the ability to add vaccines to our prevention toolbox. Thank you very much.
Thank you so much. I mean, really, I don't think you would have asked for a better star. I think the second star is actually the bigger star. And you touched on some very important key points, Professor Karim. One is rushing to buy may not be the major solution, because you may get better, cheaper ones later. The new 8 that you talked about in January is a very important point. The second point you mentioned was move away from oligopoly that might be now sitting with these 4 vaccines and bring in competition. And I think the other one you mentioned was the more effective it is, the less we need for more safety. And finally, I realized money matters. So how much are some countries actually buying for their people and spending a lot of money? I think those were really key points. Thank you so much. Is there any one of the new 8 that you believe will be non-injectable or using less of the cold chain of -70, better for Africa? Just a quick response from you.
Sure. There are 2 of the candidates that are subunit vaccines. They are vaccines we widely use already. We know how to handle them. They're pretty stable in normal room temperature. They don't need a fridge, and they're quite good. The one challenge is that they may not be a vaccine that works with a single dose. You might have to give 2 doses with those. The single dose vaccine is the J&J. That's a live vector vaccine, needs a bit of a cold chain. But if that works, to have a single dose that's a big plus. I would add it as a key factor, because just the challenge of having to get everybody back get a second dose 3 weeks later or 4 weeks later is a real problem. And just the health infrastructure the whole health infrastructure burden is double. So my point of view, single dose is a big winner if it's efficacious.
Thank you. We have so many respondents and reflections coming up. Professor Karim and Dr. Dembi, you have set a stage literally on a conversation that's going to talk about tough questions. Let me now invite our panelists who'll get 5 minutes to give their quick reflections and guide us. Let me invite Dr. Margaret Angama, who is the head of Health, Nutrition, Population Division at AU. Margaret, Africa Union, you guys have been in the forefront, continental strategy. You've heard where we are. Let's hear from you. Over to you. Please welcome Dr. Margaret Angama. Yes.
Thank you very much, Dr. Ahmed, and thank you very much for the invitation to the African Union and the Department of Social Affairs in particular. I stand on existing protocol and welcome all other participants and bring you the greetings of Her Excellency Amira El Fadir, the Commissioner of Social Affairs. I'm particularly pleased, and I wish to acknowledge also my colleague from the Africa CDC, Dr. Indemi, who set the stage as to what the Africa Union and the Africa CDC are doing. And indeed, the Africa CDC has the lead in the response to the COVID pandemic and what is happening around vaccines. So I'm going to talk more from the political and policy level and turn a question around, because often the private sector asks, what can we do? And I think the private sector should be asking, what can we do better? And this is because the private sector has already been engaging in health issues for quite a period of time. And they've also lent their support to pandemics and other pandemics and health emergencies in the past. So I have three areas which I would like to touch on in the time that I have. And the first is building and strengthening on what has worked based on the lessons that have been learned and the challenges that have been identified. And would note that, and it's already come up already, that the private sector has been particularly good in two key areas. One is in the area of logistics and the other is in financing. But the question under the COVID dispensation would be, how can they do this better? Bearing in mind that we have 55 member states, we have densely populated urban and peri-urban areas which are undersourced. We also have rural areas which are really undersourced and often hard to reach. And like the discussion just before this that took place, vaccines, the vaccines which are currently coming out or have some level of efficiency need to be stored at temperatures which could be difficult for the continent. And so the private sector really has to interrogate itself to see how it can support the logistic chains in order to ensure that whatever vaccines come out will not only be able to deliver them within urban, peri-urban areas, but also hard to reach and difficult and underserved areas. The second area, that the private sector would have to look into is to identify the gaps and find long-lasting solutions to them. And there are three key areas which are important. One is the whole area around data and the digitalization of data. And we saw this during COVID lockdowns. You have to, we have coastal countries and we have landlocked countries. And often goods and services had to move on ground through borders and were often stuck at the other end of borders because health services at borders across the continent were generally weak, and communication, data flow, and digitalization between countries and across borders was weak. People had to wait to have COVID tests be certified as negative before they could move goods and services across borders. What is this going to mean for movement of vaccines, particularly to our landlocked countries? And how can the private sector assist in digitalizing and supporting data digitalization across the continent? The second is in the area of communication. We are going to have to communicate around the vaccine to get the vaccine accepted by our populations. And we've seen eminent people in the private sector already engaging in communication efforts, such as Mr. Dangote and others, for other areas, polio, and so on and so forth. And when COVID came in, yes, they also assisted in communicating around the measures that needed to be taken, washing hands, wearing masks, keeping distance, and so on and so forth. Can the private sector also take this up to engage in communication for the uptake of the vaccines, provided the supplies are out there? The third area under this is regulation. Definitely, we are going to have fake, falsified, and counterfeit drug vaccines competing with quality and effective vaccines. It's going to happen. It even happened with all these miracle remedies which were already out there when COVID hit. So how can the private sector support not only the establishment of the African Medicines Agency, which will be the lead continental agency to support countries in regulation across the continent, but in the more short and immediate term, what can the private sector do to ensure that when vaccines reach wherever they reach, they can be certified as quality vaccines. We've had, and bearing in mind that the Africa CDC is also working with some institutions across the continent to produce vaccines across the continent and within the continent. And this also gives rise for fake counterfeit medicines and vaccines. So how can the private sector ensure that we have labeling such that it can ensure that the vaccines which will be eventually used down the line are the quality ones? The third area and the last area I would like to speak to is where the private sector, I think, is slightly lagging behind, and it's becoming increasingly important and critical, is documentation of the private sector's support for pandemics and medical emergencies in Africa. And this is important because the first pandemic in our lifetime, or at least my lifetime, that Africa was consumed with was the HIV/AIDS pandemic. The private sector did a lot. I don't have records of what they did at the highest continental level, but within member states and across member states, the private sector was deeply engaged. And then came Ebola. And again, the private sector got involved. And this time round at the continental level, the private sector provided financing for the global response at the continental level. And since COVID has come, the private sector has popped up once again, this time involving private banks to provide support. They've also been engaged in the establishment of procurement systems to procure PPE, and they're doing so much. And I think it's time that the private sector begins to keep record through documentation, which can be accessed. And this will then bring me back to my first point. It's not what the private sector can do, but what the private sector can do better. Thank you very much, Dr. Ahmed, for the time that has been given to me.
I think your message is so clear, and we're going to take it up. And it's not only doing, but doing better. Also, I heard you about logistics. I heard you about financing, and you've told us where we are doing a good job. And I think, you know, as private sector, we need to get a little bit more organized, and we are doing that step by step in Africa with support with Africa Union and your offices. And I think it gives a good segue to actually invite Paulo Gomez, who himself remembers the times of the Ebola outbreak in West Africa, who himself has been one of the champions during that outbreak to contain it, and leading private sector. And it would be a good time to invite our next speaker, who will also give his reflection in the next 5 minutes, is Paolo Gomez. Paolo, it's great to see you on the panel. Over to you.
Thank you. Thank you very much, Amit, and for the opportunity from ADS Group and Africa Health Associations in putting this discussion, important aspect of the financing of vaccine on the table. I want also to thank you personally, because you have been involved with Afro Champion since the beginning of this process with coronavirus, in engaging the African Union with a very strong sense of urgency. I think at this stage, a lot of things has been said and quite well mapped out by Professor Salim and the CDC. But you refer to the Ebola crisis, and there's a huge difference with what we are now witnessing this time, which is a very good news. The first one is that we have CDC this time. We have CDC, and it is important for us in Africa to have an institution such as CDC to be in the front line of the battle against a pandemic, because we all know that we're going to have other pandemics. This is certainly not the first one. It's not the first one. It's not going to be the last, unfortunately. So how do we get ready for the next one? And I think the good news is that this time Africa has decided to move regardless of any support coming from outside. And the African Union with the private sector, and I think you have been involved also, Amit, the special fund has been set up. And I think now Africa has mobilized at least something in the region of 16 to 20 million for CDC, or a little bit less. So which means that there's a clear conscience that we need to equip the CDC with resources. So the next time they could be even earlier on the front line, including on the vaccine. Because we have seen how the most powerful and rich have rushed to acquire vaccine for their own people. And the same scenario will happen if another pandemic comes. So how do we get ourselves prepared? So that's why I wanted, I think, in this discussion, for us to go also beyond just how we could get the vaccine for us. I think our friend from CDC has said that we need to vaccinate close to 60% of our population. The cost to vaccinate will be around 3.3 billion. And we need to mobilize probably close to 5 billion, so African countries will have access. One proposal that I think has been on the table is to how to use Africa Exim Bank to lead this process of mobilizing the resources, so the poorest country or the most vulnerable one can have access to the vaccine. 5 billion is not a lot of thing if you look at how this virus has put all our economy into a coma stage. Spending 5 billion to move out from this induced recession is certainly not a huge amount of money. And I think this is where we need to, and I agree with Professor Salim, we need to build a strong coalition among Africans to deal globally with this issue. We know that in this case, finding this money will require knocking some doors from Gavi, you mentioned others, but I think we have here room for some innovation. And one innovation could be to use Africa Exim Bank through schemes that could be agreed, for example, with the IMF, in which we will increase the capital base of Africa Exim Bank, so they will be ready to mobilize resources in the market, and mobilize resources not only for countries that need to buy the vaccine, but also to even go further in strengthening the capacity of CDC to be ready in terms of equipment, in terms of training and research, because the manufacturing aspect has to start also in Africa. And there's so many studies that have been done about the fact that, yes, it would be difficult to develop R&D in Africa, but South Africa has some capability. In North Africa, you can see it. But I think this is time now for even countries that doesn't have the, I would say, knowledge infrastructure of South Africa or Northern Africa can do. Senegal, for example, and AfroChampion is being also involved in this, setting up a pharma park, and this is purely private sector. And that pharma park can do some work in terms of manufacturing some of the main ingredients, because you know that the active ingredients for vaccine are made in India and China. So do we want for the next pandemic to rely totally on those two big emerging and champion countries, or can we start organizing ourselves to be able to manufacture some of the active ingredients in Africa? So those are the questions that we have to ask ourselves. So this goes beyond just buying vaccine. I think buying vaccine, I'm quite optimistic that we'll find a way, but I'm much more interested for a partnership between the public and the private sector to equip ourselves with resources, to start being in some of the research. We know, I mean, everything that has to take place in terms of the genomes and how those sequencing will take place. There have been some effort actually in Africa, I think in Ghana, of people who have managed to sequence, I think I don't know if it's the right term, technology, the virus in Ghana, for example. So I think that's where I see the private sector engaging very quickly with the CDC, the African private sector, to start preparing for the next pandemic, because unfortunately we know that it's going to happen. So I think I will stop here, but I believe in conclusion, and to respond to our sister from the African Union, how the private sector can do better is for us to continue to engage in terms of putting in place the market incentive. It's market incentive for the private sector to be part of it. For example, on logistics, we have a company such as Ethiopian Airlines that has played a big role in delivering some of the PPE masks to many of the countries during the crisis. I think now we can see, we can look at what kind of partnership can be established with some incentive provided from government for the private sector to be involved in delivering the vaccine with the logistic that we could put in place to do that. And we know that this is very expensive. And so incentives need to be put in place to encourage the private sector to bring the money toward those objectives. And to conclude, I want to remind people that we will need to have the state to step in, even if the private sector will play a role. I will give an example of malaria. It has cost something in the region of $800 million to manufacture the vaccine against malaria, with a lot of support for Gates and Belinda Foundation and others institutions. Although we know that that vaccine will be effective only at 29%, but you see how much it has cost to put have that vaccine, $800 million. So, and this is a disease that continues to kill our children and having very huge impact on the productivity in Africa. So let's get together to find a way for the private sector to be ready for this emergency now. But I think let's have a parallel track with the sense of urgency and the momentum to put in place some incentives to enable the private sector to be ready with the CDC for the next pandemic. So I will stop here.
Thank you, Paolo. Thank you so much for that. As my brother in private sector, I'm not going to leave your hand. We have to walk the journey together. And I know that the challenge that the governments have given us is to be organized and make that impact and document it and remain non-fragmented. I got 4 points from what you've said. One is leadership, and you really highlighted Africa CDC. And, you know, shout out to John Kengasong, who's led CDC from the front. The second point you talked about was resource mobilization, where you said there'll be enough funding. And I think we've both played, and our organizations have played that role. The third is you talked about Africa equity vaccine mapping, especially when you talked about the vulnerable shouldn't be left behind. Next year, when we actually do the Africa map, we should actually see who got left behind. Was it the ones who had the least money? And if that's the case, I think many of us on the call here will need to answer the case of that balance. And the fourth one you mentioned was manufacturing. And I think you spoke a lot about that, coupled with incentives and alignment. So I'm really, really happy, Paolo, with your input and like you summed up from the private sector side. Let me now move on to our next speaker. Paolo, thank you so much. I want to ask Mr. Samba Batili, who's from the ADS group, if you are here with us. I would like you to now take this opportunity to give your reflections for a few minutes. If Dr. Batili is with us. If I don't see Dr. Batili, can we move on to the next speaker? I don't know if we have Dr. Walid Zaher, who was with us last time, if he's joined us today from G42. Probably he's not here with us today, so I want to move on to our final guest speaker before we move to the Power Minute. Can I now take this opportunity to invite Dr. Danny, who is from one of a smaller countries in Africa, which is 90,000 or 95,000 odd population, balancing with South Africa from Professor Karim, which is one of the top 5 countries. You have a high voluminous country, and we have one that is got a small number of population, but yet logistics and vaccines and challenges across will still be on top of his mind. Let's hear from Dr. Danny Loange what his view is on the vaccine roadmap in Africa. Danny, over to you.
Okay. Thank you, Dr. Amit, and thank you for inviting me to say a few words. And considering Seychelles is one of the smallest countries in the world, in Africa, and one of the smallest economy, and in fact, it's one of the youngest economy. It is a pleasure. It is an honor to say a few words. Having listening to the previous speakers, it's impressive how much work has been done and how much thoughts has been put into the COVID vaccine for Africa. So for us in Seychelles, I'll just share some good points, and also I'll share some of the challenges that we are having. Right now in Seychelles, we have less than 200 reported positive cases of COVID. We have actually right now about 17 active cases. So for us, we've been blessed, maybe because of our location and we've been surrounded by the sea. We've been blessed by the very small numbers of COVID. But what we are being challenged with is being away from the continent and access to the medical supplies and medicines and even vaccines, and also the human resource within Seychelles. And when I listened to the previous speakers, I realized how different Seychelles is. In Seychelles, the health is basically being run by the public sector. Private sector has the main role is into clinics, and not even to the level of a secondary hospital. And when it comes to vaccine, the population, the public depends on the public sector to provide vaccines, and so this is really different from what I'm hearing from the previous speakers. So the government of Seychelles really has started venturing into vaccines. In fact, we are looking. We are looking at a commitment agreement with Gavi Alliance, and we know that it is a bit late. We are knocking some doors for us to look at how we can enter it. But even in the cost, looking at cost, for us, the cost is also a challenge, because depending on, especially right now, depending on tourism as one of our main economic pillar, and fishing is the second one. But tourism has been affected a lot, and we feel the pinch. And we in 2021 we see ourselves in a really difficult times coming ahead. So, and all these, taking all this into consideration, having that vaccine to our doorstep will be really a big challenge. And looking at not only the cost of the vaccine, but you look at the logistics, the storage, distribution, the cold chain. It is going to be very challenging for us. Even looking at the storage capacity, the temperatures that we have to keep the vaccines in, these are going to be really big challenges for us. But in summary, what I've appreciated from the previous talks, there are supports available. There are especially when I hear mentioning private sector coming into play. I think this is where if the AHB can find a way to motivate the private sector in Seychelles, that will be, and especially moving towards the access of vaccine, that could be a big assistance to us. I don't know how working with you, Dr. Amit, and how we can move on. There is an association being formed, private sector, and understand they're quite ahead of it, and this is new to Seychelles. I think this is probably a platform that we can work on. Well, this is my contribution so far, and we'll see how the discussion goes on, and I can, if there's any clarification, I can come up with. Thank you very much, Dr. Amit.
Thank you, Dr. Zani, for your insights. Despite, as you said, Seychelles being one of the smallest countries in Africa, it's so interesting, and there are definitely lessons to be learned from everybody and every single country. Yeah, and we would love to work with you as well, as you spoke that there is a private sector association being formed in your country as well. Thank you, Amit, and all the speakers for taking us through this session so far. That was a really interesting and engaging discussion that we've had. I would now like to welcome our power panelists. As we've been discussing, as a continent, we will face challenges when it comes to procuring and financing the vaccine, and efficiently and sustainably producing, distributing, and administering the vaccine. We're faced with already overstretched immunization systems, under-resourced logistics, and inventory tracking systems. And once a vaccine does become available to us as a continent, we will be faced with expansive cold chain requirements, as we've spoken already at this webinar, and a significant challenge of actually tracking multi-dose vaccinations. So it would be great if the power panel could give us 1 or 2 minutes of their views on what needs to be done so our populations can be vaccinated, and also possibly share any insights that you have from within your own organizations. So I'd like to now first call upon Professor Morgan Chetty, please. Are you there?
Yes, I'm here. Thanks. Thanks for inviting me. I'm going to actually present the findings of a conference that we've just concluded this weekend. And it's just that today, with hindsight, a lot of the questions that we had asked were answered here. But let me raise them in any case, because it's coming from the ground. The debates that we had this weekend was beyond the vaccine, was far beyond the vaccine. It was more focused around access and distribution. And people still felt that was an essential aspect that wasn't probably being looked at in depth. Also, a lot of discussions was around the under-resourced logistics. And this will be covered from the time it's manufactured till the time it's given to the patient. Unfortunately, we cannot ignore costs. We could not ignore costs based on what's in the media and what we know. And there were two aspects to costs. And as I said today, in hindsight, some of them have been answered. The first aspect of cost was against the pressures of commercial markets in light of superpowers, pre-booking and purchasing. The concerns we have is, will that escalate the cost of prices, and that will make the availability of vaccines actually drop. And around that came the issue about this particular activity and practice seems to be undermining the intention of COVAX in what COVAX's intention was. The second issue that was brought up was the pricing policy within COVAX of having a different policy for low-income countries versus high and middle income countries. And that may actually disqualify some countries that may look to be middle, but are not really middle income right now. And we're pretty concerned about this because South Africa is classified as middle income, but we saw this historically with the pneumococcal vaccine, when Gavi excluded us from the subsidized vaccine. So I think cost is still a major focus for us. Many of the other issues have been covered and are going to be covered by the speakers that follow me. So we concluded, in spite of all the experts on the panel, we concluded the meeting on a note of uncertainty around, will there be, without the information that we have today, and if I quote Zeke Emmanuel, who is on the Joe Biden's team, we would ask the question, are we sure that we will have a fair propriety model for the international distribution of COVID vaccine, as opposed to people practicing vaccine nationalism? So I want to leave it at that point because, as I said, these were the high-end things that actually have come from the ground. Thank you.
Thank you, Professor. Yeah, that is a very interesting discussion that needs to be had, definitely, about all the different price points across our continent as well, and where each country falls. I'd like to now call upon Sanjeev Gadia from Astral, please.
Good afternoon, and thank you, Kaushal. I just have two observations to make. The first one is on behalf of IATA, which has released a special guidance for vaccine and pharmaceutical logistics and distribution. And there are certain sections which are relevant for Africa. And the first one being capacity and connectivity. And there is a call on African governments to provide the air connectivity to ensure that there is adequate capacity available for vaccine distribution. And then the second area is facilities and infrastructure. Again, this is something which is very important. Vaccines need to be shipped and stored in temperature-controlled environment. And some of these refrigerants are classified as dangerous goods. Considerations including the availability of infrastructure, facilities and equipment, and trained staff are important to handle time and temperature-sensitive vaccines. The third area is relating to border management. And what IATA calls upon is to make sure that customs and the health authorities provide a fast-track clearance for vaccines, not only for the country, but also for the countries in transit. And then the last point which IATA has stressed upon is the importance of security, where vaccines are regarded as highly valuable commodities and arrangements must be made in place to ensure that shipments remain secure from tampering and theft. The second observation is one which we have done based on our experience in Africa. And then the first part of our observation is that we need a phased approach for vaccine delivery. And again, this phased approach cannot be done over one period of time. It has to be done over a period of 24 months. Because if we have to provide the distribution logistics for 60% of Africa's population, we will require the equivalent of 1,000 Boeing 747 cargo aircrafts to transport the equivalent of 1 billion doses, which is required for approximately 60% of the population. And this is the equivalent of 3 Boeing 747s flying every day for the next 2 years. And the second observation that we have, which we would like to share, is that the vaccine distribution should be routed via African airports where there is adequate cold storage infrastructure. And considering that only 10% of African airports have large-scale cold storage facilities, we really need to take a very, very careful approach. And when you look at the hubs of Nairobi and Addis Ababa, they can take care of the requirements for the East and the Horn of Africa region, while Johannesburg can take care of the Southern African region, and to a certain extent, Lagos can take care of the West African region. But what we really need to understand is that not all the vaccines will be transported by air. There will have to be a collaborative strategy where vaccine distribution can be done by air, it can be done by road, rail, and sea to their respective regions. And this is something that can only happen when there is collaboration between all members of the supply chain. The other observation that we have is that we must focus on infrastructure. We must focus on the cold storage facilities that are required and look at innovative containers that can be able to maintain the transportation and the temperature of the vaccines. We have to also make sure that there are trained personnel who can actually handle dry ice and re-icing and repackaging of the vaccines where it is required. But above all, we must make sure that we have special monitoring and tracking device so that we can actually be able to monitor and track the temperature of the vaccines during storage. And last but not the least, we must make sure that the last mile delivery has to be strengthened to minimize wastage. These are my contributions for today, and I would like to thank you for giving me the chance to make my presentation.
Great, thank you so much, Sanjeev. Yeah, that's extremely fascinating what you said about the 1,000 aircrafts that we will need. We've all been talking about the healthcare sector and kind of how many staff we will need to administer the vaccine. But yeah, first we need to get the vaccine on the ground. So yeah, very interesting facts. Thank you very much. I'd like to now call upon Dr. Ernest Darko from Broadreach, please.
Thank you so much. To me, I think even scarier than the number of jumbo jets is really, if we look at the 780 million people we need to vaccinate in a 24-month period, just simple back of the envelope mathematics, if it's a single dose vaccine, that will mean we're doing about 1 million people a day, right? If it's a double dose vaccine, obviously slightly phase shifted between obviously your first vaccine and the second dose, but very soon you're going to be in a state where you need to be doing 2 million a day because some people need their second dose while you're doing first dose for the first group of people. So as you can imagine, these numbers are incredibly, incredibly daunting, because when you think about 2 million people a day going through a process, you have to have an extremely efficient machine in place to do these vaccinations. And that machine would be so efficient, let's say in our South African context, we're talking about, in essence, vaccinating the entire South African population in about 20 days, right? Or 27 days, let's say, for our 54 million population. Which machine do we know in place right now from a process point of view could do something for every South African twice, all right, in a 27-day period? So when you start to really get to it, we have to ask what would have to be true for us to be able to pull this off. And for me, one basic fundamental thing that would have to be true is, one, the community and people would need to be prepared ahead of time. In essence, they need to be lined up for you already. We can't be at the beginning of the campaign now launching campaigns to find people, to create campaigns in different languages of the thousands of languages we have, et cetera. We're not going to pull it off. So having people ready for this vaccine is critical, and I think it's something we can actually begin to do now. We don't need to wait much longer for more data to start to prepare people, in particular, given we all know in our backyards what all the nuances are of being able to get our population to come forward in time for this vaccine. The second thing is obviously literally the health system's capacity. Dr. Slim showed us the slide of this runaway train that's going. That train is draining the resources that we need to actually do the vaccinations, right? And the worse it gets, the worse it will be when it comes time to actually administer the vaccine, because that same stressed staff who are dealing with the COVID epidemic are going to now have to be able to do the vaccination programs. And if vaccination is based on doing outreach and teams having to go to villages to vaccinate people, we're just not going to be able to do it with the resources we have. And then the final point is, what would have to be true is we'd have to have impeccable data, in particular if it's a multi-dose vaccine. We'd have to be able to track who exactly has it, has had dose 1, who has had dose 2, and to track the pharmacovigilance associated so that we can assess the safety issues, because the unprecedented speed with which we've developed and rolled out these vaccines. So we need to be able to track from a pharmacovigilance perspective as well for long periods of time how people are doing. And we're not going to be able to do this then on a paper record. So I think we have the time to think about the digital type of tools we can put in place to truly be able to rise to the occasion and meet this level of need. So those are my comments for this afternoon. Thank you.
Great, thank you, Dr. Ernest. Yeah, that is fascinating what you were saying about the 2 million doses a day. Even at the moment, as Dr. Amit Thakur was saying earlier on, we haven't even reached the correct immunization numbers for our children, the 0 to 5-year-old immunization program. So yeah, to administer this vaccine in the amount of time that we need to do it will take serious logistics. And yeah, we definitely need data to track our progress. I'd like to now call upon Kenneth Macharia from Options, please. Are you there?
I am here, and thank you for the opportunity, Kaushal. So a lot has been said with regards to how we respond to this crisis, and also this whole situation that we have with regards to access to the vaccine. Now, my thoughts around this is that, first of all, WHO gave a report the other day indicating that they had asked governments to self-report on their preparedness. And the average for Africa was 33% in relation to preparedness, and the benchmark is 80%. Several speakers have talked about the daunting numbers facing us with regards to the task ahead of us. But I want us to look at it from a different perspective. So first of all, when we think about the approach to how the vaccine will be distributed, we're constantly talking about government. And I like the fact that private sector was highlighted, but I want to bring a different perspective in terms of how private sector should be involved. We do recognize that definitely government has to be involved in establishing a framework and the structures to which the vaccine can then be distributed. However, there's also a private sector side to this. And there's an opportunity here for the private sector to be involved and to participate in establishing alternative capacity that can be utilized in the distribution of this vaccine. I took note of what Dr. Margaret highlighted with regards to the issue of certification and ensuring that as a vaccine is being distributed, that people have trust in it. And I think that's an important point, and which goes to the point of how do we ensure that there are other players getting involved in this process, one, to mitigate against the issue of cost, because cost has been talked about quite a bit, because there'll be people who would be willing and able to pay for this vaccine. However, we need to ensure that there is equitable access, and that's where the government has a part to play in this. So we need to create a market dynamic in all of this, and this is very important. Now, in doing this, some of the things we do as options is that we work with governments to build capacity. We provide technical assistance to look at things around data and data for decision making. And I think this is something that all governments should be thinking about, especially as we're thinking about capacity for their own systems to be able to distribute this vaccine. Now, as we talk about policies and the environment in which private sector, because I had the call for private sector to be more involved, I think we need to think about in a realistic way, what sort of policies should we have in place? There's this whole conversation about having policies across borders. We all know that takes time. And so we need to be realistic as to what is the best option for us right now. I think individual countries should establish policies internally that enable private sector to be involved. I like the fact that Paulo Gomez talked about capacity for local manufacturing. I think that is an important piece that we need to really take on board. We've seen this across different countries, especially now we're seeing PPEs being developed in country. And so we need to encourage that sort of thing and look at how we scale that so that we can be ready for this distribution of the vaccine, but also for future pandemics in terms of how we respond to that. So I think there's some work there to be done. Finally, I'll not talk about cold chain because we've talked a lot about cold chain, but I always think about cold chain, yes, but there's another piece to the last mile piece, and this is around engaging at the community level. And how do we do that? We've talked about capacity in terms of health workers. We just don't have enough of them. So how do we do this? And so there's a real incentive there, or there's a need for us to develop an incentive for other players to be part of this this solution that we're creating here. So I'll stop there. Thank you. Those are my thoughts for today. Thank you.
Thank you so much, Kenneth. Yeah, I definitely agree with you that the kind of policies that you were talking about earlier, we may be a bit late this time around, but definitely working on a proper kind of roadmap will help us in the future when we have any other outbreaks, or to also deal with the high disease rate that we already face. I'd like to now call upon Danny from the Africa Healthcare Federation. Are you there? I don't think he's there at the moment. We can move on. Is Dr. Babatunde there?
Yes, I'm here.
Hi. Yeah.
Am I on?
Yes, you're on.
Okay, thank you. Apologies. Something happened with my network here. Well, thank you very much for this opportunity. I think the speakers mentioned, they touched on almost everything here. And it's really interesting to see how the vaccine is the next subject after all the challenges that we faced in terms of supply of COVID products. You know, COVID has taught us a big lesson, a huge lesson in how we can come together. We've seen how the application of measures has been different from country to countries, and it has affected us in different countries, in different areas. But we've also seen how we've come together in finding solutions. I've seen countries coming up with innovative technologies and solutions to fight the pandemic. One thing that I'd like to come back to is the importance of the production of these vaccines locally. When I say locally, I'm saying within the continent, because it has two, in my perspective, it has two major advantages. First of all, it curbs on counterfeiting. When our governments, the local governments, work together in the regulatory, building regulatory frameworks, you have less counterfeited products circulating in our region. That's really, really important. But also the uptick. We've seen how some countries, because of some local reasons, have not decided to apply the measures, have affected other countries. For instance, it has increased the spread of the virus in the region, in East African regions, because some of these countries have decided to go the herd immunity way. So we really have to, and this is one of the key things that we have seen in East Africa: collaboration between governments in coming up with solutions that are better for the region, that are conducive for the region. We've seen that digitizations of some systems, for instance, some countries using drones or using robots in terms of medicine deliveries. We have to be very innovative, and this is something that has been also talked about. And last but not the least, data, and that's also something that has been shared, but we have a huge issue in data sharing. And when I talk about data, I would like to start with the existing data, whether they are reliable. Sometimes they are deterrent for investment, and most of some of the manufacturers, potential manufacturers I've spoke with, have mentioned that when the data are not accurate, it's a really big issue for investment. So to summarize what what I've just said, we really are looking at availability of quality medicines. We're looking at the availability or the discussions on production for now or for future pandemics. And I'll just stop here, and I'm seeing that we're running out of time. Thank you.
Great, thank you so much, Danny, for your comments. And sorry about there was a bit of a technical glitch, I think. Dr. Babatunde, are you there?
Yes, I'm here.
Great.
So, do you want me to take the floor now?
Yes, please. Yeah.
Okay, thank you so much. Thank you for the opportunity to join this exciting conversation. This is very exciting because we are now at a stage where we are witnessing the triumph of science in terms of being able to come up with effective vaccines that can actually save lives, save livelihoods, help us to have speedy economic and social recovery in all our countries worldwide. So this is a big deal for all of us. But nevertheless, I believe, in my view, this is just the first step. The first step because countries differ, and a lot of African countries are really not ready in terms of the deployment of these particular vaccines that we're talking about. And they are not ready because some of the countries or some of the governments or communities, they are still not convinced that these vaccines would help to really protect people from the pandemic. So we have to do a lot to convince people, to make sure that communities are on board, governments are on board, senior leaders are on board in terms of the rollout and the delivery of the vaccines in Africa. That's the first thing we need to do. I think the second thing we need to do, we also need to ramp up infrastructure for delivery. A lot of colleagues have spoken about cold chain technology, but there are many more infrastructure, all the kinds of logistics that will be involved in terms of delivery. Take, for instance, in poor rural areas in Africa, where they don't even have electricity to store any of these vaccines. What's going to happen to them? How will they be able to have access to the vaccines? So we have to ramp up those infrastructure, and this cannot be done by governments alone. This would have to be done by governments, by private sector entities, by civil society organizations, by international organizations, including the multilateral development banks, which I am representing. So I think also the third thing that we will have to do, we have to make sure that the resources that will be needed to facilitate access to these vaccines must be made available. And I think from our end at the African Development Bank, our board approved $10 billion for COVID-19 response in April. And out of that, we have been able to deploy about $4 billion to support African countries in terms of their responses to COVID-19. So going forward, we will be coordinating and collaborating with other multilateral development banks and other partners to ensure that we facilitate access and deployment of vaccines, in different African countries. That's one of the things we will be doing going forward. But I think, let me conclude by saying that vaccines in themselves, they are not enough. We need to move beyond that. We need to do accurate diagnostics in Africa, because we still really don't know those that are being infected, or those that are not being infected. I recently saw a study report on Sudan, where many people have actually died without knowing that they have died of COVID-19 because of lack of appropriate diagnostics. So we need to also ramp up our diagnostics in Africa to be able to detect, to be able to know what's going on. Then finally, we need to move beyond vaccination into treatment, because this will be the core of going forward in terms of ensuring that we are all safe around the world. And let me also conclude by saying the pandemic that we are witnessing is not just for one particular country or a particular part of the world. So which means we must work within multilateral arrangements so that all countries cooperate, all governments cooperate. This is not only for developed countries, it's also for developing countries, because even if you solve the problem or the crisis or the pandemic in a developed country and you leave behind developing countries or low-income countries or poor countries, it means that you are still going to come back to the same situation. So we all have to work together and get this done. And we continue to work collaboratively with all of you. Thank you so much for the opportunity.
Thank you, Dr. Malola. Yeah, I really like what you said about first we need to kind of strengthen our testing and tracking systems, deploy testing before we even think about the vaccine. That's so true. Thank you very much. And now I'd like to call upon Nyawira Njeru from BD. Are you there?
Yes, Kaushal, and thank you very much for this opportunity once again. So I know a lot has already been said on the panel and we are running out of time, but I quickly want to reflect on some of what I have heard, right? So we are talking about immunizing at least 60% of Africa. So this is about 800 million people, which would translate to either just about 1 billion doses of the vaccine, if you're using a single dose vaccine, or about 1.5 to 2 billion doses if we go into the double dosing type of vaccine. So for us to really be able to get this off the ground and make it a real successful immunization program, we need to have a very strong program, I would say here. So I want to reflect on two things, which I think we should not lose sight of as we continue to plan for this vaccination program. The first is on the supply chain, right? We are talking a lot about how do we secure the vaccine, how do we store it, how do we move it? But I think we should be looking at the full continuum of immunization supplies that will be required to ensure that we can actually be able to administer the vaccine to the recipients at every level. And here it is the injection devices that would be required. And in this case, talking about a double dose, we are looking at about 1.5 billion to 2 billion syringes. We see that all the vaccine manufacturers we have a different dosing. So we need to be thinking backwards about the manufacture and production, the procurement, the logistics to get them into the countries, and also to be able to provide them at every single facility, community level where immunization will be taking place. And I think this will be very, very critical. Second to that is also on staff and training. I know Dr. Amit Thaka opened up with talking about our healthcare system is already overstretched. Our healthcare workers are tired, honestly, trying to combat this. So how do we begin to roll this out? And what type of staff training and capacity building will be required? We need to also be thinking around the commensurate type of training, and especially around the correct administration of the vaccine, so that we can avoid adverse events to both the healthcare workers as well as the recipients. And we know that one of the things, if we do not get it right, then we will not be able to avoid widespread distrust in the immunization system. So I would say that these two critical tenets, the human resources, staff and capacity building and training, as well as planning for all the devices, equipment, and supplies that will be required to deliver the vaccine, remain a very critical piece. So I know we are talking about requiring $3 to $5 billion to finance this, and I hope that Africa Development Bank has also put all that into place, that we have factored some of that, because having the vaccine but not having the delivery device, we still have not made it. Thank you, Kaushal.
Thank you, Nawira. That was really interesting and definitely a key point that needed to be highlighted today. So thank you so much. So I've just been told that we actually do have someone from ADS on the panel. Is Sodo there? I think you're on mute.
Hello, can you hear me?
Yeah, I can. Hi, Sodo.
Hi, hello, everybody. Sorry, yeah, it's Sodo. I'm Director of Partner Relations at ADS Group. I'm also Mr. Bachili's Executive Assistant. Our apologies, our chairman has not been able to connect due to connectivity issues. He's in Guinea right now. But nonetheless, he would like to thank everyone for participating in this session. This is very, very important to him and to us at ADS Group. And we also like to thank you guys at AHB for this wonderful webinar. Quickly, I wanted to make sure that some of the key concerns and focuses that he wanted to discuss were conveyed. So one of the keys for us at ADS Group and for Mr. Bachili, one of the keys to a successful vaccination campaign in most of the African countries will be to develop a strong distribution mechanism, which involves both public hospitals and private clinics, and in working through public-private partnerships. So that's one of the most important things for him, as well as it is another key important part is obviously for the distribution of the vaccine in Africa. Basically, the focus would be being able to have a successful last mile distribution system, as it's obviously critical in markets with weaker infrastructure, such as all over Africa, in order to avoid the break in the cold chain, which would result in multiple important vaccines. So the third but not least, I won't be too long, I know we're coming towards the end of the discussion, is technology, the use of technology in this, and in how it's by technology, through technology and data, through access to low-cost sensors, small temperature sensors devices that could be inserted in shipments or in refrigerators. So these sensors can be inserted in order to monitor vaccine deliveries and provide practical information about shipments, all available in the palm of your hand through an application, mobile application, etc. And speaking about that, we are actually currently in discussion with a company based in the US that actually works closely with Gavi, the Vaccine Alliance, that they have such a technology called Trek Pro sensing device. And it is used, they're currently using it in other vaccine distributions in the US. And so we'll further discuss with them about the possibilities of partnering up with them, and in order to help assist with the distribution and the shipments of the vaccines. But to further discuss our concerns and focuses around the access to the COVID vaccine in Africa, I would like to invite my colleague, our managing director of our healthcare division, which is Mr. Bai Njai, our healthcare division equally. So I'll let him discuss further and convey more of the messages related to our concerns. And thank you.
Thank you, Soto. Thanks. Is Bai on the line? Okay, I don't think he's on the line. So I'd like to wrap up today's session then. So thank you to everyone who spoke today. We really appreciate you taking the time to join this conversation, and thank you everyone for actually logging on today, all the attendees that came in and joined the conversation. So what we've heard today is that we need to work together to vaccinate the African population. All the stakeholders from both the public and private sector will need to join forces. We have a significant challenge ahead of us with 54 countries and 54 different regulatory systems. So we must seriously consider if all our individual healthcare sectors have the capacity and the muscle to take on the management of the COVID-19 vaccine immunization programs. And we need to work together under the guidance of the Africa CDC. So on behalf of Africa Healthcare Business, I want to extend a special thanks to our event partners for today, the ADS Group, Equally, G42, and Mansa Media. This is the second organized discussion that we're having about COVID-19 vaccine, and we will be continuing these discussions in the new year. If you have any comments or would like to join us in our upcoming vaccine discussions, or are interested in learning more about Africa Health Business and our services and partnering with us, please feel free to reach out to me using the details that were on the screen before. Thank you for joining us today and have a good evening.